So for this assignment, Tiffany and I decided to research ADD and the different assistive technologies that go with it. So to begin, let's talk about a few common characteristics that we see with ADD in the classroom. I'm going to go over the main ones, but as you can see here on the list that there's plenty of different ones. Mainly, though, we're going to be seeing difficulty paying attention and concentrating in class, as well as difficulty dealing with organization and different structure that the teacher may be requiring. And finally, students are also going to have a lot of trouble not interrupting during the class and, again, dealing with structure in order to help counteract that interruptive behavior.
No one knows for sure what causes ADD, but studies point to a combination of genetic and environmental factors, such as low birth weight, smoking and drinking while in utero, and exposure to drugs and toxins. For diagnosis, hearing and vision tests, NEBA system, which is a non-invasive scan that evaluates theta and beta brain waves. Students with ADHD or ADD have higher brain waves, and they use this for people between 6 and 17 years of age. They also use behavioral examination for a complete medical psychological exam.
So for treatment, one of the most common forms we're going to see is cognitive behavioral therapy, also called behavioral therapy. And what this is it's a type of therapy aimed at seeing the reason why the student may interrupt in class or become easily distracted and have trouble concentrating. Obviously, the main cause is them having ADD or ADHD. However, we're able to focus on why those behaviors are occurring and then maybe find a different way for them to counteract it and overcome what they want to do. In addition to that, we also see pharmaceutical treatment using different sorts of medications. And what we found is when we use pharmaceutical treatment and cognitive behavioral therapy in conjunction with each other, we see the best lifetime results in managing the symptoms that come with ADHD. But what's really important to note is that nothing can fully cure ADHD or ADD. Some classroom challenges that we see go along with ADD are difficulty paying attention, as I mentioned earlier, concentration, impulsive behavior I didn't mention. However, that kind of goes along with being impatient and interrupting in class. We also might see students get easily frustrated and have a short temper with different assignments. If they don't understand it, they're having trouble concentrating, then they can become frustrated and irritated. They also might be slightly forgetful when it comes to managing assignments and time.
There's a lot of different accommodations that teachers can make for students with ADD. I'll go over a few important ones. For example, as a teacher, you can have students repeat their questions before the answer. You can have signals. So when you'll be asking a question, you'll throw up a signal so that students know that you're about to ask a question, so they need to pay attention. Give simple and concrete instructions. Teach self-monitoring strategies. And spending personal time with the student to build a positive relationship is also mandatory. For assistive technologies to try within the classroom, you can use computer softwares for reading, writing, and math. Brain training is also one of the computer softwares, and you can have printouts from there. Brain games can be handheld or online computer games. PDAs for calendars, timers, and reminding messages. Invisible clocks for reminder times. Noise-canceling headphones for less distraction while working independently, and screen magnifiers.